Okay, that was awesome. Thank you again so much, Kyle. One thing I just forgot to mention when we started our part 2, which is the vulnerable populations, there were objectives to go along with it. So just a reminder at the end of this part of the session, hopefully you'll have a better understanding of health impacts of climate change on specific vulnerable populations often encountered in the emergency department. I think we already have a very good sense of our pediatric population thanks to Kyle, so thank you again. Next up, we're going to talk about women and gender bias as related to climate change. So a lot of it, well, much of it will be overlapping, so we can hopefully kind of get through this here. But I just wanted to kind of start out thinking about cases. So again, emergency medicine. These are things that you could see any day in the emergency department. So we'll come back to these at the end of this particular session. But so case 1, just imagine an 18-year-old female presenting just generalized fatigue, not really any specific complaints, but you kind of notice that her partner is answering most of the questions for her and she's not answering a whole lot. And then also the partner is refusing to leave the room for an exam. So we'll come back to this case, but you know, I've certainly had a case like this and I bet many of you have as well. Case number 2, a 20-year-old female, G1P0. She's 28 weeks, 3 days, and she's having a lot of lower abdominal cramping. On your physical exam, you see pooling, you see ferning on your microscope, and a positive nitrazine test, and she's also dilated to 4 centimeters. So we had just talked about preterm birth. We'll come back to this case as well. Case number 3, a 49-year-old, past medical history of type 2 diabetes, presents to you with a wound infection. When you actually take a look, you notice that she has this bad excoriation on her dorsolateral foot. There's surrounding erythema. It's warm to touch. The erythema is streaking up to her mid-thigh. She has some skip lesions on her leg. You also note she's tachycardic and hypotensive. So we'll come back to that case, but many of you have probably seen a case of this as well. And then case number 4, 27-year-old female presenting with fever, malaise, and fatigue. She has a fever. She has some lymphadenopathy. And then on your further questioning, she notes that she's actually just immigrated, and she's presenting to your emergency department to establish care because she's new to the country. So keep these in mind. We'll come back to them a little bit later, but they're all related to gender bias and climate change. All right. So kind of as a brief overview in terms of women and gender bias as it relates to climate change. So women's relationship to natural resources is related to a few different things, or it depends on a few different things. So obviously in the world there are entrenched discriminatory norms. I think we're all kind of aware of them. It's sometimes hard to describe them and pinpoint them, but I think we can all agree there are definitely entrenched discriminatory norms. And there's very unequal power relations historically and certainly still today. There's also, we'll see some examples of violence against women and girls and how it relates to climate change and especially disasters. And then there's traditionally a gender division of labor in many households and communities. So we'll talk about things like, especially in low to middle income countries, how it's usually a woman's responsibility to go procure water or wood for their cook stove, and how that increases risk for actually quite a few different things. And then women's vulnerability to climate change, as well as environmental degradation and disaster risks, are increased due to the limited access of women to public services, social protection, and infrastructure. So earlier today I was talking about how climate change is a threat multiplier, and so it definitely is with women and gender bias as well, because there are already these huge disparities between men and women, and climate change exacerbates these during certain conditions. So I made this beautiful acronym up. The ABCDs of gender bias and climate change. You got your A, agriculture, makes perfect sense. You got your B, gender-based violence, your access to health care, and disasters. I know, it just rolls off the tongue, you guys. So it'll be really easy to remember now. So we'll start out with agriculture. This is not an exhaustive list, but this incorporates a lot of kind of broad themes that are important to think about. So in terms of agriculture, I touched on this, but agriculture is a really important employment sector for women in low and middle income countries. During periods of drought, women have to spend much more time and effort to procure resources like water. So again, there's kind of a separation or a gender separation in terms of labor, and oftentimes women are more likely to have to go find water during drought. It makes it much, much more difficult. So there ends up being a lot more school days missed for girls, because girls are the ones that have to go help their mother manage this increased burden. And there are a few different, I thought, pretty compelling statistics, but like, for example, in Benin, so girls between 6 and 14 spend at least an hour a day collecting water, whereas their brothers spend 25 minutes per day collecting water. In Tanzania, school attendance is 12% higher in girls who live less than 15 minutes from water. In sub-Saharan Africa, girls spend 40 billion hours a year collecting water, which is the entire workforce of France. So, like, just girls in sub-Saharan Africa are looking for water in the entire workforce of France. And then also a study in Africa shows that 90% of the work that goes towards gathering water is done by women. So this, it sounds kind of simple, like women have to go get water, but it perpetuates these gender biases because of this, because the girls have to go get the water, and they miss out on school, they lack education, they do not have the resources to propel themselves into their future, and then it becomes this cycle, and then it continues. So even though it seems quite simple, it's actually a huge, huge problem. So increasing access to water in low and middle income countries actually is a huge step forward in terms of gender equality. So something to keep in mind, especially as droughts continue to worsen. Gender-based violence, so the B in our ABCD acronym. A lot of it can be related to extreme weather events. So many populations are displaced and families are displaced during things like drought or flooding or hurricanes. And so if that happens, people are at higher risk of needing to go to an internally displaced persons camp or a refugee camp. And there are higher instances of gender-based violence, like violence with your partner, and then also related to the water aspect of things. The gender roles are still there at these camps, so the women are still responsible to go get water, but now they're in an unfamiliar environment. They have to walk farther to get it, and then there's gender-based violence that occurs because they're farther away from their current home, and they're in unfamiliar sort of territory. So that increases their risk to gender-based violence. And then again, intimate partner violence rises during extreme weather events. So there have been studies essentially after flooding in Pakistan and Bangladesh, after a cyclone, after Hurricane Katrina as well. All of those have been noted to have higher instances of intimate partner violence after them. And then importantly, human trafficking increases after extreme weather events. So again, it's partially due to, people are economically devastated, and then they are, sort of recruited to then end up in a situation that it's unsafe for them and they don't want to be in. But then also it goes along with they're in unfamiliar territories and they're more at risk to being victims of human trafficking. And it's not just sex trafficking, it's also just labor, so like farm labor, agriculture labor, housework, that kind of thing. So any situation in which people are forced to do something or stay in something that they do not want to. And this is, again, displacement is a huge, huge contributor to this. Access to health care. A lot of this actually overlaps with Kyle's presentation too. So climate change essentially limits women and girls' access to services and health care for a lot of different reasons that we could probably think of. So during, a storm, people cannot get to their healthcare clinic because it is not open, it doesn't have electricity, the road is washed out. They have to tend to their home, which may have been damaged by a storm. They have to tend to their children. They don't have time to go to the clinic. So for a variety of reasons related to things like extreme weather events, they're unable to access their health care for things like family planning resources. like birth control, condoms, and then there's safe sex resources. So there's a lot of studies out of Africa where after extreme weather events, people aren't able to obtain things like condoms or prophylaxis, and then the HIV rate will go up because of that. And then again, as Kyle mentioned, we have increased risks related to maternal and child health. So things like increasing air pollution and climate change, increasing air temperatures and climate change will lead to higher rates of stillbirth, preterm birth, low birth weight. There's an article that came out recently that showed that higher exposure levels to wildfire smoke in the first trimester will increase risk of gastroschisis. Do you guys remember that word? I forgot how to say it, but so that I hadn't seen before, and I thought that was really interesting. And then, again, things to think about in terms of vector-borne illnesses like malaria, dengue, and Zika. Those can cause things like neurologic disorders in children, and Zika with microcephaly and everything. So obviously maternal and child health are very, very interconnected. So this is just sort of a brief overview of how that's related. And then disasters, we've touched on a lot of this. So after disasters, you have goods and services that are limited or even unavailable, especially if you're talking about remote or rural areas, which oftentimes is where gender disparities are highest. And so you have lack of access to infrastructure, lack of access to roads, and therefore clinics. And then also it's been noted that women are more likely to be injured and less likely to survive disasters, that should say disasters once, due to longstanding disparities in information. So oftentimes they won't have access to information and won't be necessarily aware of what's going on and what needs to be done. Mobility, so if they don't have access to transportation or they're not allowed access to transportation, they're unable to get themselves out of situations. Decision making, so culturally some women don't have the ability to make decisions for themselves in the family unit or the community. And they lack access to resources and training. And another thing to think about, this starts when they're girls and they have to go procure water. And so that's part of that cycle that we're talking about. And again, aftermath of disasters, women are less able to access relief and assistance. So I want to go back to our cases here just to kind of go through these. So we had our 20-year-old female presenting with generalized fatigue. And so her partner was answering the questions. Her partner refused to leave the room. It turns out you do have the partner leave the room. You find that she's recently experienced a cyclone, which led to her displacement, and now essentially she ended up with human trafficking. So now you can get your social worker involved, talk to her, and figure out how to best help her. So remember, very vague complaints where the partner is answering everything and really refusing to leave the room. This should be kind of high alert for human trafficking. It happens everywhere. You should be screening for it in your emergency departments in the United States too. Case 2, we had our 20-year-old G1P0 at 28 weeks, 3 days. She was here with abdominal cramping. Your physical exam shows that she has preterm rupture of membranes, and she's dilated to 4 centimeters. It turns out in your community you had a recent heat wave with record temperatures. She lives in an urban environment where there are no trees, unfortunately, and she also doesn't have any access to air conditioning. So now she has preterm birth in the setting of extreme heat. So this is something that you can imagine coming through the emergency department door. Case 3, we had our 49-year-old female with a wound infection. So there was a flood a week ago, and because her home was heavily damaged, she's been unable to access care because she doesn't have transportation and the roads were wiped out. And she has quite a few children at home that needed her attention as well, and she was unable to access health care until today. So if you remember the description of her wound, she had the skip lesions, she was hypotensive tachycardic, and she has necrotizing fasciitis of her leg, which is something probably everyone's seen once or a few times. And then case 4, we had our 27-year-old with a fever, malaise, and fatigue. So the cyclone just came through, washed out supplies and roads, and she's been unable to access any preventative health services at all. And so she has a new viral syndrome. You said an HIV test, which comes back positive because she's been unable to access these health services. So I hope you can see that all these cases are something you could see any day in the emergency department, and they all do kind of go back to climate impacts on health. So anyways, that's sort of my spiel on gender disparities and climate change. Any questions before we go on to the next one?